Hi, I'm Paige Steers. I'm here with Sydney Scarborough of Jones Lang LaSalle. We're talking about healthcare. And healthcare is a organization and an industry that really has some cost-saving pressures. One of the ways that they are looking at creating advantages for their business performance is to look at outsourcing some of their real estate functions. Sydney, does that make sense for systems? And what are some of the ways that they can really capture advantages?
Well, there's significant advantages in standardizing and centralizing your resources in the management function of your real estate. Significant opportunities to reduce occupancy costs, from rents to energy to sustainability to purchase services, all those kinds of things that can add significantly to the bottom line, reducing the costs. It's paramount for the survival of our industry.
And how much does things like driving revenue, does using energy, are these things on that list?
Absolutely. You've got to look at energy management, energy usage. A lot of hospitals have looked at purchasing energy efficiently, doing forward contracts and things like that, but it gets down to the usage of energy, whether it's electricity or gas or those kinds of systems, and then beyond energy usage it gets into sustainability and what we're doing for the planet. And hospitals in particular use a lot of resources, obviously 24/7 operation. So energy purchase services, where they can reduce costs significantly. We can use our buying clout to help hospitals drive down the cost of servicing their boilers, their water treatment plants, whatever it may be. It's the occupancy costs. It's if you've got a lot of physicians in a lot of locations, what if you centralize those? Had the delivery system organized to provide care where it's needed with the right facilities, and have those physicians working together, generating referrals to each other as well as to the healthcare system. So real estate plays a huge strategic part.
In terms of using real estate as a lever for performance, how far along is the healthcare industry in doing this? You know, we've seen a lot of different corporate America industries really get the idea of outsourcing and use it effectively. Where's healthcare?
Healthcare is really at its infancy in using its real estate strategically. It's really just beginning to look at it as another source of enhancing revenues and reducing costs, improving productivity, return on investment. Hospitals have looked at all kinds of other ways, revenue cycle management, supply cost reduction, all kinds of things. Real estate's kind of been the last frontier, and it's a big frontier. The pharma industry has gone through this over the last decade and significantly reduced their cost structure using services from Jones Lang LaSalle and others. But in particular, our ability to understand healthcare and real estate and facilities and bring it all together, we can provide huge added value to them.
Well, I think that most healthcare systems need to find that added value, and a lot of pressures today. So we'll keep our eyes on that frontier in terms of looking at outsourcing as a strategic solution for healthcare systems. Thanks for sharing your insights with us, Sydney.
You're welcome. Thank you.